Hey guys, I am going to keep my camera off on this Zoom recording because we got a lot of handouts to go over. So this is our first testing strategy that I like to teach, and it is the Kaplan decision tree, and it was developed by Kaplan, and Kaplan is a kind of like a test solutions company. So their biggest one of their biggest tests that they help students for is the NCLEX. They do other tests too, like GREs, ACTs, SATs, those kinds of things. But when I was a nursing graduate, I used Kaplan to help me prep for my NCLEX. And one of the things that they did teach us was the Kaplan decision tree. And I really wished I had had this when I was in nursing school because it would have made answering priority based questions a lot simpler. So, what the Kaplan decision tree does is it helps you as the student to think critically. So, remember how we talked about Bloom's taxonomy and that your nursing exams, ATI, HESI, NCLEX, is all wrapped around Bloom's taxonomy to assess your critical thinking skills, right? Because they want to make sure that you are able to function as a nurse on the floor, being able to analyze material that you already know and apply material that you have learned, right? And evaluate that material. So, and that takes time. The learning those skills take a lot of time, but Kaplan's decision tree helps you kind of break down those critical thinking skills, and is a really great tool at those priority questions. And what I mean by priority is what's the first thing the nurse should do? What's the immediate action? What's the priority? It works really well on on those types of questions. It can help with other question types too. But its main thing is working with those priority based questions, which I think students many times find extremely challenging. Those, oh my goodness, all my answer choices are correct. What do I need to do first? So I've shared my screen on here, and you will see it'll have the Kaplan decision tree. So let's go over each step. And then I'm going to open up Saunders test bank. And I have a couple of sample questions that we can go over together, just so you can see how to utilize the tree. Okay. So the first thing that we're looking at in the Kaplan decision tree is step one. Can you identify the topic of the question? So you're reading your question and you're like, okay, what's my topic? Now, I also tell students to identify the stem. The stem is also going to like point you towards what the question is actually asking. Here in a few minutes, I'll show you how to do that. Step two, are the answer choices assessment or implementation? So we've already read our question. Now we're looking at our answer choices. And what I like to do for my answer choices is if there's a mix of assessment and implementation, I'll put I'll put an A by the one that's assessment and an I by the one that's implementation. Now, and I know when you're live testing, you're not really able to do that. So you'll have to kind of do that in your head. But when you're practicing this tree, and I can't emphasize enough how important it is to practice it because it's going to become second nature, you can put an A and an I. Okay, so next is apply Maslow's. Are the answer choices physical or are they psychosocial? Now, the reason why they're asking you, are they physical or are they psychosocial, is because we know that physical answers, usually are going to be at the top of Maslow's hierarchy, right? And psychosocial is going to be towards the bottom. So it's helping you rank, what answer choices would potentially be most important, okay? Step four, are any of the answer choices related to airway breathing or circulation? And when you get to this, you may have some that are related to circulation. You may have some that's related to airway. You can put an A, a B, a C beside the answer choice that is correlates with ABC, or just mentally take a note. But you're going to remember the airway trumps. Remember, airway trumps B and C. And then what is the remaining outcome of each answer choices? So as you have thinned out your answer choices, Then you're going to look at the rationale. Hopefully by this point, we're down to just two answer choices, right? Because that helps tremendously. And then, when all else fails, if we could only do one thing and leave, what would I do? What would I do? Okay. So that's the tree. Now, the only other things that I would add to this to remember is once you identify your topic of the question, remember your answer choice will match the topic. Okay. It's going to match. And I'm going to explain how that looks here in just a minute. Also, when we're looking at our answer choices and we're going through all these steps, we want to be eliminating answer choices as we go along. What I see students doing many times when they take a test, because I've tutored for a year before I started working for Fortis, what I see students doing is they immediately think that's the answer choice, they pick it, and then they move forward. They don't, they just start looking for that right answer choice, right? And Kaplan says don't do that. And I agree with them. You want to first rationalize and eliminate the ones that are wrong first, then narrow down, okay? And that's going to help you make sure you didn't miss anything. All right. So let's go through some sample questions. Let's see my screen. Let's make sure I'm still sharing the right thing. Yes. Okay. So let's go through some sample questions of exactly what that looks like. Okay. Give me 1 second. I want to make sure that I do this right. Uh-oh. There it goes. Okay. I just want to make sure I'm sharing the right thing. Okay. No problem. Okay. So let's go on here and we're going to go to making sure I'm on the RN because I have a PN program as well. Let's go to my bookmarks because I've already saved some questions. Okay. So let's look at question 1. The nurse assesses a client with admitting diagnosis of bipolar affective disorder with mania. Okay. Which client symptoms require the nurse's immediate action? So remember, the first thing that I said is we're looking at that topic. We're also going to look at the stem of the question. Okay. So the topic is very simple. We know what our topic is, right? It's going to be this bipolar affective disorder with mania. All right. Now, what's our STEM? What is this question really asking us? And it's asking, what is the nurse's immediate action for mania? Do you see how I broke that down? So I'm not looking at all these other little words that might get hung up. I'm just looking at immediate nursing action, right, with a client with mania. That's what I'm looking at. And so when we've identified that, we're going to remember our whatever answer choice we pick is going to match, right, our topic or STEM. And so now we can go through all of our answer choices and apply that decision tree. So the first one is assessment and implementation. Remember, that's our first step. So let's go through our answer choices. The client is experiencing what? Incessant talking and sexual innuendos, grandiose delusions and poor concentration, outlandish behaviors and inappropriate dress, nonstop physical activity, and poor nutritional intake. Now, you will see none of these are related to assessment nor implementation. That's okay. You're going to go to the next step. The next step is Maslow's. Are there any physical or psychosocial? So when you look at all of these answer choices, you're going to note that they're all physical symptoms, right, of mania with a client with bipolar affective disorder. Okay, let's talk about Maslow's just a little bit further. All right. So when you note Maslow's hierarchy of needs, one easy little trick to do is, I know these are all physical symptoms of mania. If you'll just ask yourself, which one is going to cause the most harm? That's what you need to ask yourself. Which one of these behaviors could possibly cause the most harm? So let's go through them again. Assessment, talking, and sexual innuendos. No, that's not good, but it doesn't cause necessarily any harm to the patient nor harm to anybody else. grandiose delusions, and poor concentration. Doesn't necessarily harm the patient. It doesn't necessarily harm anybody else, right? Outlandish behaviors and inappropriate dress. Now, this one could possibly be harmful if the patient is, dressing in a bikini and it's snowing outside, right? With this inappropriate dress. So let's keep that one on the back burner. Okay, we're going to keep 3 there. We know 1 and 2, we're probably going to eliminate nonstop physical activity and poor nutritional intake. Okay. So when we look at that one, if we have somebody with mania who's constantly moving about, and they're not eating and drinking well, what is that going to cause? They're going to start having possibly fluid and electrolyte imbalance. There's nonstop physical activity. They could fall. Um, a lot of things can go wrong, right? So we know that's a big safety issue. When you compare it to outlandish behaviors and inappropriate dress, we can't necessarily read too much into answer choice number 3, right? We don't want to do that. So we're going to go with 4. And you'll see that's the correct answer choice. Okay. So it's nonstop physical activity and poor nutritional intake. I stopped right there because none of these are related to ABC. Okay. And if we could only do, and when we already rationalized why the nonstop physical activity and poor nutritional intake is the most important. And if we could only do one thing and leave for this client with mania, right? We're going to help try to calm them down, give them an activity that maybe isn't that they can participate in that's not very physically demanding, and address this poor nutritional intake. We're going to get them something to drink. Maybe it's protein shakes. Maybe it's protein shakes and water because that's the only thing that we can get them to take at that moment. But that's what we're going to do. If we can only do one thing for them and leave, that's what we're going to do. Now, I can't emphasize this enough, when you're practicing a tree, you can practice it on your sample questions in the back of your books after each chapter of whatever class you're taking, or um, you can always, I know Fortis sometimes gives out students access to Saunders. Saunders is really a very affordable program. It's like $30, $40 on Amazon. Um, but don't just stop when you're doing your practice questions. Don't just stop and say, oh, I got the correct answer. Next. I don't care if you got it right. I don't care if you got it wrong. You're going to go over here and you're going to read your rationale, because that is something that Kaplan taught us. Kaplan taught us no matter what, you go back and read your rationale, even if you got it right, as to why that was the right answer. The reason why they want you to do that is because you're going to be gleaning tidbits of information, right, as to when you're test taking, why that is the priority at that moment. And when you keep practicing, and if you listen to any YouTube test taking thing, podcast, whatever, they are going to tell you at the end of the day, being successful in nursing school for nursing school exams, ATI, HESI, NCLEX, it doesn't matter. The more you practice these types of questions, the better you're going to get. And that is truly what's going to make you successful. So let's read the rationale. Mania is a mood characterized by excitement, hyperactivity, euphoria, excessive energy, right? Client's mood with mania may be elevated, expansive, or irritable. They have a hard time concentrating, okay? There's all of the options reflect a client's possible symptoms, right, with mania. However, the one that is the problem is the one that compromises physiological integrity. So let's keep reading. We're not done yet. The client's need is physiological integrity. So that's how we know it's at the top of the list, a top physical need, okay? Cognitive ability. What does that look like? That's your Bloom's taxonomy. So this question was testing your ability to analyze the information to pick out what will be the priority action for this client. Okay, the content area is mental health with mood disorders, and it's addressing their safety. Okay, all right, let's keep going. Okay, the nurse is developing a plan of care for a client with a diagnosis of severe vertigo from Meniere's disease. who is being admitted to the hospital. What is the priority nursing intervention in this plan of care? So back to our tree, we're going to identify the topic and we're going to identify the stem. Topic is Meniere's disease. Now, I don't know about you, but there's no way you can remember every diagnosis, symptom, whatever on the planet when you're in nursing school. There's no way to retain everything. So maybe you get to a question like this, and maybe you know what Meniere's disease is. Maybe you don't. That's okay. All right, we're gonna look at what is our STEM. So our STEM is going to be priority nursing intervention for diagnosis of severe vertigo, okay, from Meniere's disease. That is our topic. What's our priority, right, for Meniere's disease with severe vertigo? That's all we're looking at, okay? So let's go down through our answer choices. We have safety measures, self-care measures, food items to avoid, knowledge about medication therapy. Okay, so we ask, are these assessment or are they implementation? Safety measures, no. Self-care measures, no. Food items to avoid, no. Knowledge about medication therapy. None of these are assessment or implementation, right? The nurse isn't assessing anything, and she's not doing an intervention for anything right here. Okay. The next one, Maslow's hierarchy of needs. All right. Are they physical? Are they social, psychosocial? Safety measures, physical. Self-care measures. That sounds like psychosocial, right? So that goes, number 2 is going to go to the bottom of our list. Food items to avoid is physical. Knowledge about medication therapy. That could be also considered psychosocial because it's education, okay? It's important, but it's education. So see, look, we've already brought 2 down. We know we're not going to be looking too much at self-care measures. We know we're not going to be looking too much at medication therapy right now. We have 2 answer choices that are physical, and that is safety measures and food items to avoid. Now, we go on to, does ABC apply? Nope. Airway, breathing, and circulation do not apply in these, okay? What is the rationale? So even if we didn't know what Meniere's disease is, we do know that the client has severe vertigo, which is dizziness, okay? So when you have a client with severe vertigo, right, and you're stuck between food items or safety measures, you know safety measures is going to come first on Maslow's. You also know, right, if you have this client, and let's just say they're admitted to the hospital, they're coming into the emergency room, and you're their nurse, and you're triaging them, and you're trying to get them to the bed, right? What are you going to do at that time? Are you going to say, Mr. Smith, by the way, you have Meniere's disease and there's I think it's salts or something like that. There is food items that they have to avoid. Here's a food list of items that you need to avoid, or it's gonna make your Meniere's disease worse, right? Or are you gonna be like, this dude is dizzy as crap, and I need to put safety measures in place real fast so he doesn't get up and fall and bust his head open, to be very frank. So we know safety measures is going to be top priority, right? And if we could only do one thing and leave, if we could only do one thing and leave for this dude, we are going to make sure he doesn't fall and bust his head open. Okay. So Meniere's disease can cause severe vertigo. Now, let's say you didn't know what Meniere's disease was and the question didn't tell you they had severe vertigo. You could still use that tree and realize my top pick is going to be safety measures. I don't know what the heck Meniere's disease is, but I know my priority is going to be physical. I know if I can only do one thing, then I can leave for them. I'm going to make sure they're safe. Okay. So that's only one way that you could deduce that. The priority nursing plan of care would focus on safety issues to prevent fall or injury to the client. Although self-care measures, dietary therapy, and medication therapy may be components of the plan of care, safety is the priority issue. So look, so we have the client's need is safe and effective care environment. You look down here at your cognitive ability, boop, there's your Bloom's taxonomy. It's looking at your application level, okay? That's how that one works. And I want to point those out with Bloom's taxonomy, with what it's testing you on, so you can really get into your head of me just straight memorizing information is not what's going to help me to pass in nursing school. I did a video on Bloom's taxonomy. If you haven't watched it, definitely watch it because it kind of explains that process and some study tips to give. I also did another video on study tips, but you want to get really good at developing critical thinking skills so you can answer these types of questions. Okay, we're going to do this one, and we may do a couple more, we may not. Okay, the client, excuse me. The client presents to the emergency department with upper GI bleed for gastric ulcer and is in moderate distress. In planning care, what nursing action would be the priority for this client? Back to our decision tree, okay? So, what is our topic? What is our sim? Our topic is upper GI bleed. Our stem is going to be priority nursing action for GI bleed. That's it. That's all I want you to think about. What is my priority for GI bleed? My topic is GI bleed. Okay. Let's look at our answer choices. We have 1, assessment of vital signs. 2, complete abdominal exam. 3, thorough investigation of precipitating events. 4, insertion of nasogastric tube and hemostat for emesis. Okay. Excuse me, hematest for emesis. I'm sorry. Okay. So back to assessment and implementations. Which ones are assessment and which ones are implementation? Now you'll see we actually do have a lot that are assessment and implementation. So we have 1 is assessment of vital signs. We get a little A there. That's assessment. Completion of abdominal exam. That's assessment. Thorough investigation of precipitating events. That's assessment. Insertion of NG tube and hematest of MSS. All right, that's implementation. So when you have a mix of assessment and implementation answer choices, what should be going off in your head is ding, ding, ding. What's my nursing process? Because we know the nursing to process ADPI is going to tell us that we have to assess that person first before we do anything else. And I'm going to do another video where we really break down the nursing process and how to utilize it in click style questions. So I'll go over that more thoroughly later. But when we use our nursing process, we know that assessment always comes first. The only time that I've ever seen a question present where we wanted to go ahead and put an intervention in place or implement something is that question is going to have all of your assessment data already in it, meaning the nurse has already thoroughly assessed this patient. There is nothing else more she can assess. She must intervene. She must implement. She must put an intervention in place. Okay. So, but in this case, all it's asking is priority nursing action for GI bleed. Okay. So we're going to put 4 at the bottom. So that gives us 1, 2, and 3. So now we're going to look at Maslow's hierarchy of needs. Are these answer choices physical or are they psychosocial? As 1 is physical, 2 is physical, thorough investigation of precipitating events. You could say physical, you could say psychosocial. We're going to label it as physical, okay? When in doubt, we're going to label it as physical. All right. Are any of the choices related to airway, breathing, and circulation? Yes. Number 1, ABC, right? That's going to look at their circulation. It's going to look at their blood pressure. It's going to look at their heart rate. It's going to look at their respirations. It's going to look at their O2 sat, right? That's definitely related to ABC, right? So put a little star there, okay? Completion of abdominal exam. Nope, not related to ABC. Thorough investigation of precipitating events. Also not related to ABC. What's the rationale behind each answer choice? Okay. Assessment of vital signs. If I know this gentleman has a GI bleed and I get their vital signs, what is that going to tell me? It's going to tell me if their blood pressure is low and their heart rate is up, they've got a pretty bad bleed, right? That would be some good assessment data for us to know. Complete abdominal exam. Well, if we complete the abdominal exam, their abdominal exam may be normal. Now, if it was board-like, right, that would be a red flag, but they could be completely normal. So that wouldn't be necessarily above, we wouldn't want to necessarily do that above assessment of vital signs. Thorough investigation of precipitating events, that may give us some clues as to what happened prior to the GI bleed, or possibly give us information on maybe a root cause of what caused the GI bleed, but not 100%. Now, if we could only do one thing and leave, because we looked at these rationales, we're going to get our vital signs, okay? And another way you could think about this, if I could only do one thing and leave and not get my butt chewed out by the doctor, I'm going to look at this gentleman's vital signs, right? Because it's going to tell me how bad that bleed is, if they need oxygen, if they need fluids. And then once I get their vital signs going, then I can do 2 and 3, okay? And then possibly see if the doctor wants to give an order for an NG tube, all right? And now remember, we said that our answer choice will always what? Match that topic. So assessment of vital signs is going to match our STEM because it's our priority action. It's what we would do first. It matches. Priority is first. So assessment of vital signs is going to match because that is what we would do first. So again, the rationale is just showing that it would indicate the amount of blood loss that has possibly occurred. It also goes in here to give a little bit more information. The client may not be able to provide subjective data until immediate physical needs are met. Although abdominal exam and assessment of the precipitating events may be necessary, they're not the top priority. So we're looking at physiological integrity, and it is our cognitive ability is analyzing. Okay, so let's stop on that one. That gives you some good ideas, 3 good ones on, because we're going to do more practice questions in the future on how to utilize Kaplan's decision tree. Okay, let me go through here. There we go. All right. So hopefully that would help you kind of break down that information. If you want the Kaplan decision tree, it's free online, but you can also email me through Fortis. I'd be more than happy to send it to you. Kaplan has wonderful resources. I can't say enough good things about them. I will say this. You got to practice doing this tree over and over again. When I was prepping for NCLEX, we had a Kaplan gave us a 3-day one-on-one tutoring, group tutoring with a Kaplan instructor that we had to do. And then they gave us the book and the login, and told us how many questions we should be taking daily, right, to prep us for the NCLEX. You have to practice this over and over and over again to get really good at it. Now, don't do like I did, right? Because when I was practicing for my NCLEX, I had also already been hired on by a hospital and was working under my nursing mentor. And I would work my shifts and then come home and then just cram as many questions as I could possibly get in. And I tell you what, by the time you do, 50 questions, your brain is pretty mushed. So what I would tell you to do is utilize the Pomodoro method when doing questions. That's just a simple method that nurse educators or just educators in general like to give students tips on when studying. It means this. You study for 25 minutes, or in this case, you do 25 minutes of questions. You take a 5-minute break. You do that 4 times, and then you take a 30-minute break. Okay, so you do that for 4 rounds, and then you take a 30-minute break. I also want you guys to know that any method that I talk on here, whether it's the Kaplan decision tree or it is the Cornell method for studying, for note taking, or like I just mentioned, the Pomodoro method for studying, these are well-researched methods. I'm not pulling these out of the air, okay? I take a lot of time to research things before I get on and do these videos so I can give you the best tools possible, tools that I wish I had had in nursing school that I didn't realize until much later on. Okay. So I hope this helps. The next one we may be doing I may be doing the nursing process. I'm not 100% sure for the next video. But it's very, very important to thoroughly understand how to utilize the nursing process when you're doing these questions. It will help a lot. So thank you so much.